Hi there, John Miller, osteopath here again. I've been asked to give a couple of exercises for nerve problems in the neck, going to the arms. Obviously, we've got to be very careful to differentiate between disc injury and standard nerve root entrapment that might occur in the neck. One of the best ways to determine the problem is to have an MRI scan, so I'd certainly recommend people do that first of all, so as not to aggravate the problem. So usually with cervical spondylosis, that's the neck. It starts to curve, increasing in like so. So it tends to usually come forward initially, then curve back this way, put a lot of compression through here. And there's lots of tiny holes coming down the side of the neck, and these holes get compressed, and the nerves that come out of them also become compressed, and that often gives pain, which goes down into your arm, or down your chest, or your back. And one of the ways to loosen that, of course, is not just to work specifically on the neck, but to work on the posture. So if your posture is, as I'm sitting now, quite bad, your upper back is flexed forward and your neck is this way, you've got to address that first and foremost. So what I normally recommend, what we call standing angels. So like snow angels, but there's just no snow and you're standing up. You come and stand up against, I've got a window here, you can do a wall if you like, so your back, shoulder blades flat against the back of the wall, okay? Make sure your head comes nice and close as far as you can. And the key to this is to draw the chin to the chest. Now, my posture is not really very good. So what I need to, my head tends to come forward quite a bit. So one thing I often do with this is get a fairly flat cushion, okay? Place this behind the back of my head, up against there. And then what I try and do is draw my chin to my chest like this, okay? So as if I'm a bit inbred, which I might be. You never know. Actually, I shouldn't say that. My parents will approve. So anyway, I know I'm not inbred. But anyway, arms up here like this, placing also your lumbar spine as close to the glass as you possibly can on the wall. You should do this against wall, really, not against glass. It's a risk you could break, you can fall through. So don't do as I do, just do as I say. And again, lengthen the neck by drawing the chin to your chest. You're really feeling a length going up here. Now what you can do with the arms is you can let them slide up and slide down. Make sure the elbows are touching the wall as you do this. It's up and down. And up and down. Make sure you're not doing this, of course. Make sure the shoulders down and back all the times. It may be easier to start simply by bring the arms into a supinated position like this and just pushing back against the wall this way as well. And try to reach down towards the ground when you do this and push the hands into the wall. And this is really good just for opening all this area up here, okay? And flattening and lengthening the spine. So we want to do that first of all. Secondly, of course, we want to try and work towards getting into the neck directly. So I've already explained that you want to try to make sure your neck has been lengthened. And the way we do this is by drawing the chin to the chest. You can do the same thing, but also open up the gaps in your in your neck on the side if there's a lot of compression out. I've had a bit of a problem in the past on my right side when this has kind of risen up. I've done exercises to try and level this a bit more, but this is still a bit tight, especially on this side. And I'm concerned that there could be some problem with neuropathy coming from the neck. So one of the ways that I try to counter this is by stretching the muscles on the side. So simply take your hand down, grasp the chair to the bottom of the chair. So you're reaching quite low down, okay? Now what you want to do now is, again, draw the chin to the chest a little bit like that, okay? And hold the tummy at the same time, so make sure everything's flattening against the chair. Now place your hand above your head and reach around the ear. Now I don't want you pulling down, I think I explained in my other videos, if you end up pulling down, you just put compression through the vertebrae on the other side. You want to try and aim in this direction, so you're aiming towards the ceiling. So you're supporting the head and the hands, and of course you're pulling towards the ceiling. So you're putting a stretch through here, okay? And the way I do this again is by drawing the chin to the chest, so very undignified, and pulling that way, okay? And of course with this hand here, if you're reaching down and grabbing parts, you can really get a nice strong stretch through the side of the neck, okay? Normally do this, say, for 10 seconds, and then repeat 2 more times. Now be very careful with the stretch, because there is a tendency that if things are entrapped, if you keep doing this, it can really irritate it and really flare up. So I would say if you're doing it maybe 3 times a day is enough to start off with, and that's 3 times 3 times a day. Of course, if you have pain afterwards, then I'd recommend you stop, okay? Maybe reduce the amount of stretch. You don't have to go all the way over. You just want to go part of the way. Remember, you're trying to tract your neck and pull it that way as you reach down, okay? You don't have to really pull really hard against the bottom of the chair. It's a subtle motion just to open things up. Make sure, of course, your head here is resting nicely against the arm there. That's good, okay. And release. If you can, obviously do both sides. If you find one side is higher than the other. And the other things you can try to do with this is also at the same time, if you've got a cushion, you can even put the cushion behind your back to fit in the lumbar arch as well if it's a bit uncomfortable, or even further up between the shoulder blades. I have seen some people put footballs between the shoulder blades and then reach back to get those shoulders back a bit further as you do this. So to show you an example of how I do that, I don't have a football, but I've got a pillow. I'll roll the pillow in half. I'll place this a little bit higher up my back like that, okay? So I can then try to arch over this. I could do with a higher back chair really. But you can get your lumbar spine to here and then your middle back here. And then you can really lean back into that. And again, with the hand, to use the hand on this side, pulling down, grasp the head, chin to chest, and then pull the head to the right a little bit and get a nice stretch there. Again, hold for about 10 seconds and relax, okay? That's just a good start for a nerve root flossing exercise. So you've got 2 things there. One which is for your overall posture, and the second one which is specific to the neck, to open the neck up again, okay? Now, thinking about it, there's probably one more thing we could do, and that's loosen off these trapezius muscles. They get really tight on a lot of people. They're very, very tight. So it's very similar to the stretch we just did. The difference is you want to try and stretch out, again, by drawing the chin to your chest, but you let your head kind of drop forward a bit and then to the side. So a little bit of rotation there. So you get in the back of this area here, okay? So you can still use your hand, okay? I usually grasp not the side of my head this time, I go further back. There's a bony bit here where the skull begins, and I just allow it, just guide the motion down there. So as if I'm looking down towards my opposite knee. So right now, as I'm facing you, this is my right side here, and I'm going towards my right knee. So my right arm will go above my head, and the head goes down towards the knee like that, okay? And again, with this hand, you can also reach down before, as we said before, and give a nice stretch. And release. That goes the other side. You grasp the side of the chair, chin to your chest, and just lean forward very gently. So you get a nice stretch, and you can feel it all the way up this section here, okay? All right. So before the stretch was for the side of the neck, this one is for the back and side of the neck. Same rules as before, 10-second stretch, 3 times if you can. No more than 3 times a day in case it irritates. If you're finding it's working and it isn't irritating it, obviously feel free to do it more frequently. You could probably do it every hour or so, but maybe just the once. But give that a try, see how you go, and leave your comments in the box. Speak to you soon. Bye-bye.